iron absorption. First, it is food that contain ascorbic acid. A lot of food, like fruit and so on, containing ascorbic acids. And food contain muscle protein, also enhance protein, also enhance iron absorption. There is some fruits in spite contain ascorbic acid but inhibit absorption of the iron, like banana or strawberry and melon. You know, we eat a lot of melon during summer. Why? Because these fruits contain high level of the phenol. Food fermentation aid iron absorption by reduce phthalate content. This is another aspect. Now, how iron transport? As you know, transferrin is the major protein responsible for transporting iron in our body. Transferrin receptors that is located in all cell of our body, or most of all our cell of the body, can bind with two molecules of the transferrin. Both the transferrin concentration and transferrin receptors are important in assessing iron status in our body. So where iron storage? Tissues with higher requirement of the iron, like bone marrow, placenta, and liver, contain more transferrin receptors. So once in tissues, I mean, when the iron go to the tissues, iron is stored as ferritin. So the name of iron storage in our body called ferritin, and also some part of it is called hemosiderin compounds, which are present in the liver, RE reticular endothelial cells, and bone marrow. The amount of iron in storage compartment depend on iron balance. That means positive or negative when it is used. Ferritin level reflect amount of the storage of the iron in our body, and is important in assessing of the iron deficiency anemia. Now, go to the more deep in the physiology of iron. So what are the role? What is the function? Why iron is very important in our body? So iron is vital function in our body. What is this vital function? It is carry of oxygen from lung to the tissue, and also transport of electrons within the cells. So it is cofactor of essential enzymatic reaction like neurotransmission, synthesis of steroid hormone, synthesis of bile salts, and detoxification process that is happening in the liver. So these are just some aspects shortly in the physiology of the iron in our body, from the transportation and storage and absorption. Now, how we can diagnose the patient with the iron deficiency anemia? So first, from history, as in the other disease. Then for clinical. Clinical, the sign symptom of patient with the anemia, fatigue. Patient can present just fatigability or dizziness or light headache or just palpitation. Okay, and there is signs. The main sign, it is pallor, smooth tongue, cholinicia in the fingers or nails, splenomegaly, dysphagia, and especially in elderly people. And after the clinical, we go to the laboratory, and also more invasive bone marrow for staining iron or bone marrow, sorry, and also response of the iron supplement. And this trial, we give the patient iron and looking for the response. Now, what are the lab finding in patient with the iron deficiency anemia? You know, we can take CBC, and you know CBC is the first window for lab in hematology. Looking for the hemoglobin, actually it is less than 11 gram per deciliter. Looking for the MCV, MCH, MCHC, MCV and MCHC and MCHC, all of them it is low. Ferritin level low, but here RW D diameter for the red blood cell, it is more or high. And iron deficiency capacity, here it is binding capacity also high, and erythrocyte protoporphyrin is also high. So we have 3 high and 3 low. in addition to the microcytic hypochromic anemia. So here we can see this is normal blood film, and see this is microcytic anemia, looking for the small RBC. And here we can see this is RBC, called hypochromic. That is mean the stain is low, hypochromic. Okay. Now, consequence. What is happening if patient have iron deficiency anemia? That is mean if have pallor or headache or palpitation or dyspnea or dysphagia. What is happening in the future? So in maternity, I mean patient pregnant, so increased DMAT, and is fetal does not receive the good amount of iron, will precipitate a fetal mortality or fetal congenital disease, with increase also maternal death. Increased risk of premature delivery and low birth weight. Learning disabilities, if the baby come out and born, may be presented with learning disabilities. Reduce work capacity. If patient tired, can't do good work. Impaired immunity, because patient without immunity or low immunity precipitated with high level of infection. Inability to maintain body temperature. Associated risk of lead poisoning because of the pica. Because you know the patient with iron deficiency anemia more go to take some salt from the wall or from the soil. So this is a risk for the lead poisoning. Now, how can manage